In this video, we will be discussing the catheter and leg strap, the difference between the night bag and the leg bag, how to change your bags, how to empty your bags, how to clean your bags, and some tips. A Foley catheter is placed in your bladder to help the area where the prostate was removed to heal. The catheter remains in your bladder by an inflated balloon. It will be continuously draining urine from your bladder. This balloon can move freely in your bladder and sometimes cause irritation on the area that is healing. Thus, the leg strap must be on at all times to help secure your catheter and prevent irritation or damage. There are two ports on your catheter. One is used for the balloon, and the second one is where your urine will be draining out from. Your urine will drain into clear tubing and then into the drainage bag. There are two types of bags that connect to your catheter, a night bag and a leg bag. The night bag can hold up to 2 liters, therefore it is preferred to have on overnight to avoid getting up to empty it while you are sleeping. The leg bag can hold up to 500 milliliters. It is handy for daytime use as it can attach to your leg so that you can put on your pants and or conceal that you have a catheter at any time. With any bag, you will need to keep it below the bladder level at all times. This promotes drainage via gravity. Be aware of how your tubing is placed. Any kinking or coiling of the tubing will block urine from draining appropriately. When you are ready to change your catheter bag, ensure that you have a clean workspace, for example, a portion of a table or counter space. Gather your supplies. This will include your night or leg bag, alcohol swabs, and a clamp. In this demo, we will be switching to the leg bag. Prior to beginning, perform hand hygiene. Preventing infection is important with your catheter. You are doing this by washing your hands before and after getting into contact with it. When performing any tasks, you are not required to wear gloves because everything is a part of your body and your germs. If you have someone assisting you during any tasks, it's best that they wear gloves for protection. Now we will demonstrate how to switch your bag. Seat yourself in a comfortable position. Remove the catheter from the leg strap. Clamp the catheter. Then clean the catheter with an alcohol swab. Disconnect the drainage bag from the catheter by pulling forwards on the clear tubing. Place the old tubing aside. Clean the tip of the new drainage bag that is going to be attached with an alcohol swab. Connect the new drainage bag to the catheter by pushing it as far as it feels like it will go. Remove the clamp. Reattach the catheter to the leg strap. If you have just attached the leg bag, secure the leg bag to your calf using the Velcro straps. When you are finished, perform hand hygiene. Once your bags are half full, they will need emptying. Begin by performing hand hygiene. When emptying the night bag, be ready over the toilet. Have your bag in your hand and remove the green emptying spout from the holder by pinching the 2 green sides together. Face the emptying spout into the toilet. Place your thumb on the top of the metal clamp and gently push it forward. You will hear a click as urine should begin to flow. When your bag is empty, gently push down on the metal clamp and slide the spout back into the holder. When emptying the leg bag, lift your foot to place it on the toilet seat. Face the bottom of the bag into the toilet. Flip the emptying switch that is located on the bottom of your bag forwards to empty the urine. Flip the switch back to close it. Perform hand hygiene once again. Each time you empty your bag, you will need to assess the quality of your urine. The ideal urine is clear, dilute, and yellow. If it is very concentrated, if there is fresh blood and or blood clots, and or it is very foul smelling, then rest and drink more fluids. If there is no improvement within 1 hour, then call your urologist or return to your nearest emergency department. After switching your bags, whichever one that will no longer be in use will have to be cleaned. To do this, first mix 1 part vinegar and 2 parts water in a large glass. Next, run the mixture through the tip of the tubing into the bag and let it rinse through. Empty your bag, place the bag on a towel or allow it to hang to dry to use next time. To emphasize, you do not need to clean your bag when it is currently attached to you, even after each time you empty it. You may help prevent infection by keeping the night bag connected for the entire duration of your recovery. Some patients know that they are not going to leave their house or have any company during their recovery. Feel free to leave the night bag on the entire time for ease. You are also assisting in preventing infection by decreasing the chances of introducing bacteria with each change. The night bag may be hung on the side of a clean and empty garbage bin to allow appropriate drainage. When showering, your leg strap should be removed prior to the shower. Drainage bags may be left lying outside of the shower, or they may be disconnected. It's surely up to you. Bladder spasms can occur when the bladder muscle suddenly squeezes and there is a release of urine. This will usually feel like a sharp contraction to the bladder or lower abdomen. Urine may also leak around the catheter. This is often caused by just the presence of the catheter in your bladder, as your body is not used to having it there. It may also occur if the catheter is blocked. The pain can be managed with painkillers. The leakage can be helped by placing incontinence pads in your underwear. You may also prevent the episode from occurring by ensuring that your catheter tubing is streamlined, which means not kinked or coiled to prevent backflow. This concludes the catheter care teaching video. Please check with your nurse or healthcare professional if there is a discrepancy in information. If you have any concerns, please feel free to ask questions.